This tool is one of several resources available for children and young people's mental health commissioners and is supported by NHS England's Mental Health Clinical Policy and Strategy team. You can request information on the wider Commissioner's Support Programme via the email address displayed on the screen here. In order to create your first activity model, you will need to log into the modelling tool. If you do not have a login or are unsure how to access the tool, please refer to the video titled Introduction to the SDMT, which can be found at cypmh.scwcsu.nhs.uk. Click on the Community tool heading at the top of the page and select the Local Scenario Manager option. There are two options within this menu, Intentions and Collaborations. The Intentions Manager allows you to create a set of activity that you are anticipating for your area over the coming year. Similarly, the Collaborations Manager allows you to create a set of planned services, but also enables you to import or export activity to or from other organisations. It also gives you the ability to perform what-if scenarios in order to help you adjust and adapt your resources to meet anticipated demands. We will look at the Intentions Manager first. Click on New and give your dataset a specific name. On the Information tab, you will need to select the intention year, so this will be the year that you are working on, and also a status, whether it's draft, proposed or published. These options won't affect your activity, however they're provided to help you label your modelling and to enable you to distinguish between how advanced the modelling concept you're working on is. A description can be added to provide any background or additional information to anyone who might want to use the data. Once you have set up your intention, you are ready to begin adding some data to it via the Historic Activity tab. The Historic Activity tab asks you to record the activity you undertook last year in order to help estimate how much activity you should anticipate in future. We recommend basing this information on either the last full financial year or on the previous 12 months. You will need to list all of the services that were commissioned. This can be done via the Add a Service button. Give the service a name and enter the number of cases undertaken. You will then need to select options from the drop-downs below. Please note that the drop-down options will change based on the selections that have been made. For example, if I was to select non-health and specialist, it would give me these services. But if I was to change that to universal, it then changes them to only these ones here. Each area of the tool has a pop-up help window which will give you further information about the area of the tool you are currently using. We would recommend checking these if you are ever unsure about something within the tool. Once you have entered all of your services, they will appear in this list, showing you the number of cases that have been entered for each area. You can enter as many as you need to. Once you have created all of your services, you can then further modify these through the Future Changes tab. This is covered in the Taking It Further video. When you are satisfied with your intention activity, please press the Save button at the top of the page to save this for any future use or reference. You are now ready to use this data to model for the coming planning year. Close this box and return to the Collaborations page. Press New and give your collaboration a name. As with the Intentions Manager, you will be prompted to select the status of your data and the year that you are working on. The Costs drop-down box allows you to import your staff costing values. You can either select the system default or a locally defined set of costs if required. Select the intention you have just created in order to import your historic activity. You should see your activity on the right-hand side of the page. You can also add a description about your collaboration if you want to. The Services tab is where you will identify all the services that deal with the anticipated activity levels in your area within the coming planning period. Services can either be based on an existing service, such as the ones we have created in our intention, or they can be newly defined services that have not yet been created. For this example, I will be using the services that we have already set up. Select your service from the drop-down and press the Base Service On button. This box allows you to define the service, including the name of the service and the number of cases that are anticipated in the planning period. As we are using a service that has already been created, these options will already be populated. However, you can change any of these if you want to. The Resources tab allows you to state the resources anticipated so that the tool can estimate costs and waiting time impacts. Some of these will be set to the system default values based on the type of service that you have selected, but these can be edited if needed. Complete any of the boxes that do not yet have a value. Each of these options has hover text to provide further detail if you are unsure about what you should be entering. The Staffing subtab shows the staffing estimate based on the details you have entered so far. A costing estimate is made from broad staffing numbers you are likely to require. These estimates can be overwritten in the Your Preference boxes if desired. When you are happy with your service, press Save. The figures at the bottom of the page show you the number of cases of your baseline activity that have been met by the services that you have added. The Sharing and What If tabs allow you to import or export data from other organizations and to optimize your services based on potential scenarios you may wish to plan for. These areas will be covered in detail in the Taking It Further video. The Summary reports provide you with summaries of the information and outputs that have been entered. Click on the report that you wish to view in order to see the summary information. This can then be exported from the tool into more convenient formats if desired.